predominantly present in the right side of the chest. Another remedy which comes very close is cuprum. Cuprum is the king of spasms. Ferrum is the king of allergy. Cuprum is the king of spasm. King of muscles is magnesium. Any muscular, it is magnesium. King of spasms, it is cuprum. So it could be chest wheezings, the circular muscles, wherever it goes into spasm, it is cuprum. And cuprum ars, like arsenic alb, cuprum ars is one of the important remedy for bronchial asthma. And another characteristic of cuprum is it is one of the most indicated medicine for epilepsy. You cannot treat the cases of epilepsy if you remove cuprum from your medicine box. Arnica is one of the remedy which comes in children who have suffered injury, and there is no other indication. Since I received the injury, I have developed asthma. No other indication, no modalities. You can think of arnica. Very important. Not many physicians use it, but it's a very good remedy which cannot be missed. Tuberculinum is a remedy which can be given to many children, or adults rather. It can be given to many adults who do not respond to the remedy. As an intercurrent remedy, it's one of the best remedy. Ideally in children, the combination which is present is basilinum and antimony tart, which would cover your more than 30 to 40% of the cases. You give a dose of basilinum as an intercurrent medicine in children, followed by antimony tart. The resistance will improve, the frequency of the attack will change, the space between the attack will increase. Okay, we'll just take up very nice and a very interesting case. This particular patient, Mr. B.D. Nangyan, was 67 years old, a very well-known social worker. He was such a known social worker. When he came first time to the clinic, my inside consulting room, outside room was filled, absolutely jam-packed by the people who accompanied with him. They said that this gentleman is a very, very nice social worker and you must treat him and you must see that he is normal. So it became a very major responsibility. And unfortunately or fortunately, he had been to all the possible chest physicians, all the possible homeopaths of Bombay, all the possible physicians of Bombay, because being such a known figure, people would recommend him and he would go. So it became a major responsibility for me. He was brought way back in 1978. He was suffering from bronchial asthma for last 40 years. So you can understand the duration was not a recent one. It was very, very old. He would have 13 tablets every day and he was dependent on the pump all the time. He would use this bronchodilator pump practically every hour or more frequently. So you can understand the drug dependence. A complete history was taken, the case was repertorized, re-repertorized and reworked. Interview history was taken again. The medicine was changed without much of relief. He had been to most of the well-known homeopaths of India, not only Bombay but India, without getting much relief. Even I was pocketed by him. So I could not give much relief. Every time the followers would come and say, "Sir, please do something, please do something." And I would say, "I'm doing my best." And it became a very sorry situation. You can't do anything. I was frustrated. I could not help him at all. No amount of reworking of the case helped. But there were few points which I observed. Now, during the working, I observed few very, very important points. In spite of suffering for last 40 years and drug dependency, the spasms in the chest were minimal, and there was hardly any secretion. Secretions have to be there in the psychotic phase. So in spite of that, so many, even in the worst of the crisis when he had come, there were not much of rales, bronchi. It was just few spasms. The patient was capable of managing most of the day-to-day activities. He never had any problem in managing anything. He was very active in the social activities. In fact, he went out of his way to help people. He was heading one of the most important religious organizations and school. He was the secretary, which was one of the biggest organization of India. You must be aware about Arya Samaj. So they run many institutions, schools, colleges, teaching, religious disciplines. So a lot of things are being done under one banner. One fine morning, he came with his wife, and the wife told me very interesting fact. What was the fact? That she said that he was totally dependent on steroids, bronchodilators and inhalers. He would take inhaler half an hourly or 1 hourly, and he would get relief. Now comes a very important point. And many times, even if inhaler doesn't have any medicines, it may be empty, but still by pressing, he feels better. Based on this, I decided the medicine. See how easily we can come to a medicine. Leading personality requires support. Psychotic to syphilitic expressions, graying of hair and other things were there. Anxiety about health, chilly patient. I thought that in spite of the changes, the disease the disease is still in psychotic phase predominantly, and nothing seemed to be working on him, considering he had been treated by many homeopathic, Ayurvedic and allopathic doctors. See, so many factors, you put them in order. So I thought of giving Thuja 1 dose daily. See, he has been to many physicians. He has taken a lot of medicines. In spite of that, you don't see the emphysematous changes. So what does it show? It shows anxiety and empty pump still working. What does it show? Fixed ideas. Fixed ideas. That I must take that anxiety with fixed ideas, and it works. It was gradually increased from Thuja once in a day to twice in a day to 3 times in a day to 4 times in a day. There was marked changes during the 8 weeks of treatment, and within 8 weeks all the 13 tablets were stopped. This was the first time in his life he saw this result. He says, "Dr. Shah, what have you done? My all medicines are stopped." I said, "So that now you can work better." The frequency of using the pump also decreased. His appetite improved. He started feeling better. He started moving out. Overall, there was substantial improvement, as appreciation of the phase of the right was right. It proved to be a new experience, a new learning, a new dimension in management.